Hello everyone, I'm Dr. Jung-Ho Cha of Mina Plastic Surgery. Today we will be discussing Smas facelift and neck lift procedures. Smas is an abbreviation of a word superficial musculoaponeurotic system, what does that mean? So I would just say that it's like the sheath of the facial expression muscles. So once that gets sagged, your whole face gets sagged. Now, there are a lot of ways to do the lifting of the sagging tissues of the face. And full Smas facelift is the procedures where we go in and actually pull the sagged Smas layers all the way up and going back in time and putting it right back to, like, let's say 10-15 years before. It is a very effective procedure. However, this is relatively a little bit more invasive, and so for some people seeking for a less invasive procedures, there's an option called mini facelift. Now, what mini facelift is it really varies among a lot of doctors, but what I define mini facelift is as not doing the whole face areas, but we rather focus on certain parts of the face areas where it sags the most. So the incision itself is a little bit smaller, the dissection is a little bit smaller. Now, wherever the incisions go in, now the scars are going to be there, but there are certain techniques and procedures that we can do to minimize those scars. So if this is done properly, in about 6 months, a year from after the surgical procedure, scars will show if you look at it very closely, but not a lot of people are going to notice the scars. It is not going to show too much. Now, the answer to that is yes and no. The facelift procedures can be done later in time if you have enough period in between those two procedures. But it is not advisable to do the procedures repetitively because as wounds heal, the tissues scar, and with excessive scars, then when we do the surgical procedures on those excessive scarred areas, then the outcome can go in the direction where we can't anticipate. I would say on average, you can do the surgeries 2 to 3 times at most, but I don't recommend doing it the 4th, 5th, or 6th times. The indications for this surgery is not about how old you are, but it's rather by the characteristic of a person's skin tissues. People with loose skin tissues, they start feeling the sagging of their face even early in the 20s, but whereas some of the people with very tight skin, it can well go into like mid-50s and still doesn't sag. So I would say it's not rather about how old you are, but rather more about how much skin drooping there is. Facelift procedures can be done after thread lift procedures. A lot of people receive thread lift procedures when their sagging is not that great. And then in time, when the sagging has become a little bit larger, then they decide to go for the full facelift. Now, in that case, we do the surgeries going through the full Smas lifting, and I have never seen a problem caused by the previous thread lift procedures. Liposuctions in the lower chin area is a very popular procedure that I do here in my clinic. Liposuctions in the face area and on the neck area is very different from the liposuction of the body parts. Now, that is mostly because in the face areas, we have a lot of nerves and very important glands and structures on the face areas. And so we need to avoid the damages to those vital structures. Because of that, the suction power that we do for the liposuction on the chin area is very different from what we do in the body parts. Now, liposuction in the chin area is effective. Maybe not perfect, but it is effective because of two reasons. First is that it is a liposuction, so we remove the fat tissues. So the volume of the fat tissues on the chin area has become a little bit smaller. You're going to be able to notice the size difference from before the procedures. The second reason is that the process of liposuction is a part where the cannula goes back and forth inside, underneath the skin areas, which causes the adhesion to the soft tissues on the inside. And as wounds heal, it causes additional lifting effect so that you're going to have a more defined jawline and a smaller lower chin. For people with excessive sagging on the neck area, I recommend that we do the neck lifting along with the liposuctions. Now, the sagging of the neck is caused by the loose skin, but also caused by the loose muscle layers on the inside, which is called the platysma muscle, starting from the jawline all the way through the neck area. And because it's sagging, it's separated apart from each other. And how I do the neck lifting procedures is that I do the tightening of the muscles on the inside. So we tighten it from the inside, remove the excessive skin, and it is going to be very effective in those people. After the facelift and neck lift procedures, about 3 to 4 hours after the neck lift and facelift procedures, as the anesthetics go away, you're going to feel a little bit of a burning sensation on the side of the face and in the neck area. It usually lasts about a day. So people say that it hurts until the noon of the day after, and then after that, the pain is almost free. With the neck lift, you are definitely going to have a more defined jawline. Its jawline is covered by the facial portion and also by the neck portion. So if the facelift procedures and the neck lift procedures is combined, then your jawline is going to be a lot more definite. What's very important after the facelift and neck lift procedure is the surgery process is the part where we elevate the skin and do the surgeries on the inside and close it back up. What we want is we want the wounds to heal completely. We don't want any kind of empty spaces underneath the skin area on the face and the neck. And because of that, we are going to wear some of the pressure garments on those areas. Actually, the longer the better, but what I recommend is that you wear those pressure garments on the facial areas 24/7 for 1 week, and then after that, you can wear it when you're indoors, but when you go out, you can take it out. Today we discussed Smas facelift and neck lift. This is a very effective anti-aging procedures, and I believe a lot of people are actually seeking for the information on these procedures. I hope my session today has been of some help for you. This was Dr. Cha of Mina Plastic Surgery. If you have any questions, comments, feel free to contact us. Thank you.